We begin our journey with the patient presenting to the emergency department, and there making the first contact with a member of the CHW hub. The CHW will complete a thorough chart review and connect with the patient's providers. After, the CHW would then complete the social determinants of health screener, which asks if the patient has any needs in the following areas: applying for health insurance, food insecurity, utilities assistance, transportation needs, establishing primary care, and if they are experiencing interpersonal violence.
Hi, my name is Elizabeth. I'm one of the community health workers here in the ED at Rush. How are you doing today?
Hi, Elizabeth. Nice to meet you. I've been better. I've been having some headaches.
I'm sorry to hear that you're having headaches. The reason why I came to visit you is just to offer you resources that we have for all of our patients here. So we do connect our patients to social worker or primary care provider or any other resources that we might have. Do you have a few moments to complete a SH screening?
Yeah, I have time.
Okay. Currently, or in the past 3 months, has lack of transportation kept you from any medical appointments, getting food or medicine, or providing care to a family member?
Yes.
Are you currently without any housing?
No.
Are you currently worried about losing your housing?
No.
Currently, or in the past 3 months, have you worried your food or run out before you had money to buy more?
Yes.
Currently, or in the past 12 months, have you run out of food or been unable to get more?
Yes.
Currently, in the past 12 months, have your household members gone without utilities such as heat, water, or electricity?
Yes.
Are you currently unemployed and requesting resources?
No.
Are you currently concerned about your physical or emotional safety?
No.
In the past 12 months, have you been hit, slapped, kicked, or otherwise physically hurt by someone?
No.
In the past 12 months, have you been humiliated or emotionally abused in other ways by your partner, ex-partner, friend, or a family member?
No.
Okay, so I will go ahead and send the resources over to you via text message. Whenever you receive that link, go ahead and click just to make sure that you're able to access those resources.
Okay, yeah, I got the link.
Okay, great. And then are you already connected to a primary care provider, or do you need to be connected?
I need to be connected.
Okay, so I will go ahead and place a referral. They should be reaching out to you within these 3 days so that we can get you connected. And then are you connected to medical insurance, or do you need insurance?
I don't have any insurance.
You don't have insurance? Okay, so I can also place a referral. Our public benefits specialist will also reach out to you, so just make sure that you connect with them so we can help you apply for the medical card.
Thank you so much.
Thank you so much.
Based on their responses, the CHW can then provide the patient with their individualized resource list from Unitas. The CHW will also ask any additional qualifying questions for Wellness West and determine the patient's eligibility, and with the patient's permission, then enroll them into the program. The CHW will also submit any referrals as needed for social work and CHW outreach, or if the patient would like to establish care with a provider and requires assistance with appointment navigation. After the CHW concludes their visit with the patient, they will go ahead and submit a referral for public benefits enrollment and another referral for appointment navigation, and thus conclude their documentation. The work orders will then be assigned to additional CHWs for outreach. The CHWs will conduct their outreach within 1 to 2 days. Here we see the first CHW to conduct outreach will provide the patient with education on the information needed for the public benefits application process and ask additional questions.
Hi, good afternoon. May I speak with Sandra, please? Hi, Sandra. My name is Leonore London. I'm calling you from Rush University Medical Center. I'm a public benefits eligibility screener, and I'd like to speak with you, Sandra, in regards to a couple of questions to assist you in applying for public benefits. Sandra, are you currently employed? No? Okay. Do you attend school full-time or part-time? You do not. Are you married, Sandra? Sandra, are you currently pregnant? No? And do you have any children? No children. Okay. Well, Sandra, what I'd like to do is put you on my schedule. I would say I have availability for this coming Friday, and I would like to know if you would be available Friday and what time. 2 p.m.? Okay, and Sandra, is this the best number that I can reach you at? Great. Now, Sandra, when I call you back, Please have your driver's license, your state ID. Also, I'd like you to have pen and paper. And the reason why is because you're going to assist me with creating your user ID and your password. And I need for you to keep that information just like it is a credit card. Because after I speak with you, Sandra, I will not have access to that information. Okay, well that's it, Sandra. That's great. So I'll call you back. I'll be calling you from this number this coming Friday at 2 p.m. to assist you with processing your application. Do you have any questions? All right, Sandra, great. Thank you. Nice talking with you. Bye-bye.
As seen with our public benefits enrollment specialist, the patient was provided with information necessary for their application, the steps the patient will need to take, and an appointment date. They will also receive outreach from another CHW, this time for appointment navigation and PCP connection.
Hello, my name is Daniel. I understand you need a PCP or a family doctor.
Hi Daniel, yes, thanks for reaching out. I still need a PCP.
I don't see anything in your chart. What insurance do you have?
I just got off the phone with Leonora. My Medicaid application is pending.
Awesome, sounds good. In the meantime, let's get you set up with Community Health until your insurance is active.
What is community health? I'm not familiar with it.
Sure, Community Health is a partner with Rush to provide primary care for those who are insured, and they charge on a sliding scale. Would you like to be connected with them?
Yes, please.
Great. Can you please verify your address for me?
6969 West George Street.
Awesome. All right, let's go ahead and set up an appointment to see if we could schedule a PCP for your headaches.
Yeah, thank you. That would be great.
Can you also let me know how much you make annually?
$32,000.
Perfect, thank you so much. Let's go ahead and check the availability through Community Health's website to see if we could set up an appointment maybe next week at Monday, 2 p.m. Does that work for you?
That works.
Okay, great, perfect. Let's see. All right, looks like we need to complete a new patient form. I will send you the form via text. Please confirm that you received the link.
Yes, I received it.
Great, you'll need to bring the following items to your appointment. List of any medications that you're currently taking, proof of income, proof of address, and please make sure that you arrive 15 minutes before your appointment.
Okay, sounds good.
All right, great, sounds good. Can I help you with anything else?
No, that'll be all.
All right, wonderful. Well, thank you so much and enjoy the rest of your day.
Thank you so much for your help.
After connecting with the CHW, the patient was then seen at Community Health, where testing was completed. The patient was unfortunately diagnosed with hypertension and cancer, something they might have missed had they not connected with our team. A referral was then submitted for the Cancer Center and E3 team. The Cancer Center CHW will connect with the patient and address any additional needs identified. The patient has their first appointment with the Cancer Center in the Radiology Oncology Department, and a referral has been made to the CHW for transportation. During the conversation, additional needs come up. CHW Kelly walks over to Radiation and Oncology to speak with the patient.
Hi, my name is Kelly. I'm a community health worker at the Cancer Center. I just got a referral here from a nurse that you needed assistance with transportation to and from your appointments.
Yes, that's correct. My family is not able to take me to my appointments since they happen so frequently.
Okay, great. So we can help you out more with that. I was wondering if you had current transportation.
No, I was hoping you'd give me some suggestions.
A few options for you. One of them is signing up for transportation through American Cancer Society's Road to Recovery. They have a volunteer run service where they take you to and from your oncology appointments. The other option is we can help sign you up for PACE Paratransit, and we can also provide you with the PACE booklet, and that booklet can provide you 5 rides for your visits. And another option, if you do drive, we do have parking vouchers for the Bruce Schlager building at the Cancer Center as well.
Okay, I'm interested in the PACE transportation option.
This is a one-time source, but a lot of our patients really like it.
My friend would like to join, but they also can't afford transportation.
We can also offer them a PACE booklet as well, and they can go with you in the Road to Recovery program. Can I help you with anything else?
No, not that I can think of anything.
No problem. I would like to offer you more information on Waterford Place. Waterford Place is a cancer resource center that provides support for those who are struggling with their diagnosis with cancer.
Okay, thank you so much for that information.
You are more than welcome, and here is my information if you need more support.
Thank you so much.
Now that the patient was able to connect with the CHW at the Cancer Center and address her transportation needs to and from appointments, she can now connect with another team member to address her hypertension diagnosis.
What's your name?
Sandra.
Nice to meet you, Sandra. I'm Dana. I'm an E3 worker for the hypertension program. Is this a good time to check in?
Yes, this is a good time.
Perfect. So I'm glad that you're participating in the program. For the next 12 weeks, which is roughly about 3 months, I'll be checking in with you, seeing how I can assist and anything that you will need during this program. We will be following from our Heart Healthy Manual, which is going to teach you how to establish new heart healthy habits. Is it okay if I send that to you through my chart?
Yeah, that's fine.
Okay, awesome. Thank you. So also I'll be connecting you with the rest of our team too. So we have Lori, she is our nurse. Sam is our pharmacist, and then we do have a social worker on staff, which is Elizabeth. So just make sure, like, if you have any questions, comments, or concerns, that you're always in contact with me, and I will reach back out. And also the team will reach out to you too.
Okay, sounds good.
Also, and you have an active My Chart, correct?
Yes.
Awesome. Great. It looks like your device was delivered last week and you started using it on Sunday. Have you had any issues or problems with that?
No problems. It works fine.
Okay, awesome. Also, make sure that you check your blood pressure every day, because it's really, really important that we get to see the ebbs and flows of how you work throughout the program. So, of course, we want to make sure that we eliminate any problems ahead of time. So, I'm always available. You can always call me if you have anything. I did see that you were interested in a program that we have here called VeggieRx when you were enrolled.
Yeah, when I was enrolled, they mentioned something about receiving food assistance, and I was wondering if I could get help with that.
You definitely can, and I will make sure that I go ahead and place a referral for you. So someone will be reaching out to you within the week, okay?
Okay, thank you so much.
Awesome. So far, do you have any other questions for me?
No, not at the moment.
Awesome. So I'll be connecting with you next week, and I will speak with you then.
Okay, nice meeting you.
Awesome. Nice to meet you.
After connecting with the E3 team, the patient received education and information towards her hypertension diagnoses. She also received a blood pressure cuff and was encouraged to develop new healthy habits. The CHW was also able to address the patient's food insecurity by connecting them through a referral to the VeggieRx team. The CHW can submit a referral for Food is Medicine to connect the patient with the pantry.
Good morning.
Nice to meet you.
Nice to meet you too. Okay, thank you.
Hi, my name is Nikisha. I'm a community health worker here in the Food is Medicine VeggieRx Pantry. And nice to meet you too, Sandra. I see that you've been having some difficulty with food. It happens to all of us at one point. So there's nothing to be embarrassed about. We love helping people because that's what we do. The pantry is a 3-month program, and you'll be able to come in. This will be your first month, so you'll come in, you'll get a fresh bag of fruits and vegetables today, as well as you'll get some items from the shelves just this one time, okay? And then over the next 2 months, you'll receive a delivery to your home of fresh fruits and vegetables from a company called 40 Acres. They'll send you an email, and then you have to respond to the email. And once you respond to the email, then they'll schedule your deliveries. Do you have any questions or any other?
So today we'll be able to shop the shelves, right?
Yes, today you'll be able to take some of the items from the shelves. You'll get one of each item, and we'll go from there. Okay?
Okay, sounds good. Thank you.
Okay, I'm gonna ask how many in your household?
It's 3, so I have 2 children. One is 8 and one is 16, and he attends Crane High School.
Oh, that's wonderful. We have a program at the high school that we have community health workers that can assist your child while they're in school with any concerns that they may have.
Okay, that sounds perfect. Thank you.
You're welcome. Come on, let's go shopping.
Okay.
Great. Would you like spaghetti or macaroni?
Macaroni, please.
Would you like tomato sauce or pasta sauce?
Pasta sauce, please.
Tuna or chicken?
Okay.
Chili with beans or without beans?
With beans.
Black beans?
Yes. Thank you.
Pinto beans?
No, that's okay.
Garbanzo beans?
No, that's okay.
Kidney beans?
No. Thank you.
We have tomato soup, lentil soup, chicken noodle oats, beef with vegetable, and beef barley and clam chowder.
Can I get chicken noodles?
Turkey. We have grape jelly or strawberry jelly.
Strawberry, please.
Peanut butter?
Yes. Thank you.
Beef broth, vegetable broth, or chicken broth?
Beef, please.
Cooking oil?
Yes, please.
We have honey oats or plain oats.
Honey, please.
Oatmeal, we have variety pack, we have baked or brown sugar or plain.
Can I get the brown sugar?
Do you need any seasonings?
Can I have garlic powder?
Yes, sure. Sauteed crackers?
Yes, please.
Once the CHW connects with the patient and closes a loop referral to our vendors for food delivery, the patient's information was shared via secure chat to Crane for our school-based health center CHW. Here, the patient and her children can receive assistance.
Hi, welcome to the School-Based Health Center. My name is Vanessa. I'm a community health worker, and I will be helping you with resources today.
Hi, Vanessa. It's nice to meet you.
Nice to meet you. So I see right here that you need some help with the medical card, connecting with a primary care doctor, and some vaccines for your son. Is that correct?
Yes. My son doesn't have any health coverage, and he hasn't seen a doctor in a while.
Okay, so I can start by completing the medical application today. Once you receive an approval letter, we can schedule a follow-up appointment, and that way you can come back to the clinic, and I can find you I can help you find a primary care doctor.
Okay, that sounds great. Thank you.
Okay. Also, you mentioned that your son needs some vaccines. Is that correct?
Yes, that's correct.
Okay, I will have the clinical coordinator schedule an appointment with the nurse practitioner, and that way he can receive his immunizations.
Okay. For his appointment, will he be called down, or does he need to tell his teachers? What's the process for that?
Oh no, the day of the appointment, he can just come in and get vaccinated and return back to class.
Okay, sounds good. Also, I had a question because my sister, she also needs some vaccines. So I was wondering if she could come here to the clinic, or who is eligible for vaccines here.
Unfortunately, here at the school-based health centers, we only see students that come here and their parents. However, I can share some information. There's a Rush mobile vaccine team, also called the Congregate team, that will be having any events in your neighborhood, and they will be providing the vaccine at no cost.
Okay. Does my sister need to schedule an appointment?
No, she doesn't need an appointment. Just make sure she's there at that location, and just look for a Rush table, and they will help you with the process.
Perfect. I'll be sure to pass along the information. Thank you so much.
After connecting with the school-based health center CHW, The patient and her sister will finish their journey with our congregate team. Here, the patient's sister can receive the vaccination she requires and address any final needs.
How are you?
Good. Good afternoon. How are you?
Fine, thank you very much. My name is Melita. I'm a community health worker, and I'll be helping you with your registration today. What vaccines would you be interested for today?
I would like to get the flu vaccine.
Okay, the flu vaccine. Do you have any questions regarding the flu vaccine?
So yes, one question that I have is what are the effects after the vaccine?
Okay. Have you ever had a flu vaccine before?
No, never.
So this is your first time ever?
Yes.
Okay. First thing said after you give me that information is that after your first ever flu vaccine, we would like for you to stay with us for about 15 minutes in order to monitor that you don't have an adverse reaction to it. After that, and with anyone given vaccine, including the flu, regular symptoms are that you may develop a fever, light fever, and for that the recommendations are for you to take any over-the-counter medications such as Tylenol. Usually, sometimes your arm is irritated in the area of the injection. For that, we recommend cold compresses for you to keep your arm mobile and to keep hydrated also. Okay? So since you said that you have not ever been vaccinated here with the flu or any other vaccine, we will be creating a profile for you with our database vaccines in Illinois. And for that, I'll just need general information. Do you have any questions concerning that?
No, I have, the only ID I have is my matricula from my country. Is that good enough?
We actually don't need any type of ID or identification. All that I need is to take your information, regular information, such as your name, your last name, your birth date, and your address. Okay? And now that I have taken this information, I will start your database record and include this vaccine in the database. That'll take me about a second or so, and I'll do that now. And then after this, and you'll have your entry in any one other given time when you take any other vaccine in any one place, such as a hospital or a clinic or even any other place like a Walgreens site. You just let them know that you have your profile and they'll add that vaccine to the database as well.
Oh, okay.
Any other questions that I could answer for you today?
Yes. Does it hurt a lot? Because I'm afraid of shots.
No, not at all. Like any other vaccine, like I said, the most that you could get is a sore arm. Other than that, no. Sometimes we do ask our clients, how have you reacted to any other type of vaccine? Usually, the fever is one, or the sore arm is another one. So however you reacted to other ones, the flu would be just about the same.
Oh, okay.
We also have general information giving to all our clients with all the vaccines. Today you will be receiving a flu informational sheet that you could read as you wait to get your vaccines, and we are ready to take you to the vaccination site.
Okay, that sounds good.
Okay, follow me.
As you see, the CHW Hub can connect with patients in multiple aspects and address a variety of needs. From the emergency department all the way to our community events, the patients that interact with our team are well taken care of and provided with resources and education to live a healthier life.